The study we did last season, we enrolled hospitalized patients, adults with influenza-like illness that were hospitalized at two hospitals in Southeast Michigan, the University of Michigan Hospital in Ann Arbor and the Henry Ford Hospital in Detroit. And the goal of the study was to find out how well the influenza vaccine was working. What we found was that the vaccine was 47% effective in preventing influenza-associated hospitalizations. It was a bit of an unexpected result, primarily because the influenza virus that made most people sick last season, the influenza A H3N2 virus, was not well matched to the H3N2 virus that was included in the vaccine. Additionally, there were CDC-funded studies carried out in the outpatient setting that found that the vaccine was much less effective than what we found in our study. One potential explanation could be that the vaccine could be more effective in preventing more severe illness, but obviously we're really cautious with that interpretation, particularly because it's one relatively small study during one influenza season. We're pretty excited because we've been funded starting this season as part of a new CDC-funded network to look at vaccine effectiveness in the hospital setting. So we'll be one of 4 sites looking at that over the next 5 years. And so that should give us a lot bigger sample size to answer some of these questions. I think in general, there's still a lot of work to be done in figuring out how well the vaccine works against more severe outcomes. It's kind of surprisingly an area that we don't know a lot about right now. So I think number one, just finding out how well it works and refining the methodology to measure how well it works. I think it is important to look at how well the vaccine is working each year and monitor that because obviously, as you kind of said earlier, there's some people who may not be interested in getting the vaccine, and if we can show that it is working, it may encourage people to get it more. So there's the ACIP group through the Centers of Disease Control that releases recommendations each year. And for the past several years, their recommendation has been that everyone 6 months of age or older, without a contraindication, get vaccinated each year. I think that the proportion of people that get vaccinated each year has increased over the past several years. I think especially it's so easy to get vaccinated now that you don't necessarily have to go to your doctor's office. You can go to a pharmacy or grocery store. It's available all over the place.